Today we are doing a check-in of sorts. Next Wednesday, March 12th, will mark 5 years since our province announced its first case of COVID-19. The months and years that followed were turbulent, and we relied on so many people for information and advice to get us through that time. Today we're going to check in on some of those people. We're going to hear from a virologist, a pediatrician, and an infectious disease doctor. Some familiar faces for sure. How have their lives changed since 5 years ago, and what are they doing now? We also want to hear from you. How did COVID change your life? Maybe you changed jobs or professions, maybe you started or ended a relationship, or maybe you developed long COVID and it isn't over for you. Call us 1-800-716-2221. That's 1-800-716-2221, or you can send us an email, bluesky@cbc.ca. I don't remember exactly when we started talking to Angela Rassmussen during the pandemic, but we talked to her a lot. The virologist at the Vaccine and Infectious Disease Organization at the University of Saskatchewan in Saskatoon was part of a team chasing a vaccine for the COVID-19 pandemic. Angela also studies emerging viruses and can explain what's happening in science in a really understandable way, which is kind of key in a stressful time, that whole understanding thing. We've heard from her more lately as she works with her colleagues to save CDC data being deleted by the government in the United States. She's also closely watching H5N1, the bird flu, but she has made some time to be here with us this afternoon. Hi, Ange.
Hi, Sam. How's it going?
Good. How are you?
Busy and very stressed out, but otherwise doing pretty well.
That doesn't sound, that all things considered, terrible, but great.
Well, I'm American, so it's been very difficult and disturbing the last 6 weeks to see what's happening in my home country. And certainly it has been very stressful for me and everybody else who lives here in the great nation of Canada, given what is happening between our two countries. So it's not a great time, but I'm trying to find the silver linings.
Let's go back 5 years, because you study emerging viruses and you were looking at SARS-CoV-2, the novel coronavirus in those early days. I remember calling it novel, like the antivirus in the beginning, because I didn't know anything about science in that way. But what do you remember about those early days, even maybe before we had a case here in Saskatchewan?
Well, I was, at the time, I was on the faculty at the Columbia Mailman School of Health in New York City. My family lived in Seattle, so I was actually routinely once or twice a month commuting cross country to either be in the office or be with my family at home. And I remember coming back after the holidays on, I think, January 2nd or 3rd, and hearing for the first time that people in my center had spoken to people in China about what was happening in Wuhan, and everybody at the time was like, this is something to watch. As we watched over the next several months, we saw cases in China start to tick up and up and up. And I will say that I remember so vividly the day that I realized that we were in a lot of trouble. It was February 29th, 2020. I had been asked to go on Ali Velshie's show on MSNBC. So I was in a car on my way from my apartment to 30 Rock to do this interview. And it was in the morning and it was on a weekend. And I was looking at Twitter. And my colleague, Trevor Bedford from the Fred Hutch in Seattle, tweeted that they had sequence data from what we were calling nCoV 2019 at the time, that suggested that there had been community transmission undetected occurring in the Seattle area for 3 to 6 weeks. And it was that moment that I remember so vividly, because that was the moment where I said, this is not an isolated outbreak. This is a pandemic, and this is going to change everything. And I got to 30 Rock and told the producer immediately that we needed to have a completely different discussion on the show. And I was right. Trevor was right. It indicated that, the virus had already gotten out of control in the U.S. And I went to Seattle a couple days later, and I never went back to New York until I moved out of my apartment there.
When did you know that things were really escalating and that you had to start kind of speaking out to help people understand what was going on, not just in the science community, but more layman people like myself?
Yeah, so I had actually had a little bit of experience with doing media. I worked on MERS coronavirus since 2013, and I've worked on Ebola virus since about the same time. There were big MERS emerged in 2012, and so there were big MERS outbreaks, and people were very concerned about that. The Ebola outbreak in West Africa in 2014 to 2016 was also something that was very much on people's minds. So I did have a little bit of experience talking to the press and talking to the public about these emerging viruses. And so I was really already doing some of that work at the very beginning of 2020 as people wanted to know, like, what's a coronavirus? What is going on with this outbreak in China? And then it just continued to get progressively more and more of a demand until after I had gone back to Seattle to do my lockdown time there. I realized that it was actually now becoming part of my job, because there was so much like misinformation, there was so much confusion, people were so afraid. It also was kind of a unique time for scientists because for the first time ever, the concept of a preprint was something that reporters found out about and that they started reporting on. So a preprint is an article basically that you're going to submit to a scientific journal but hasn't gone through the peer review process yet. And people would release preprints, which was fantastic for scientists because we really got to see the new data that people were producing in almost real time. But at the same time, a lot of reporters and a lot of journalists, many times they got transitioned from whatever beat they had been on to the science beat and had to learn about all this stuff. And then they see a new preprint that says, oh, well, it came from snakes, or it's a hybrid with HIV. Neither of those things are true, but those are both preprints that came out, didn't have any scrutiny, and so they got picked up by the national press. And things like that I find are really not helpful when the public is trying to deal with a medical crisis and they're trying to make sense of everything that's going on, and having information out there that isn't accurate, that hasn't gone through a peer review process, really requires a lot of context and nuance to have people, understand it correctly. So I realized that I am pretty good at that, and that would be an important role I would play, especially since I chose to spend the pandemic 3,000 miles away from my actual laboratory with my family. So that seemed like something that I could do to really help people make sense of the whole situation.
I'm wondering, you mentioned that people were really afraid, and you are a scientist who is used to gowning up and going in and dealing with really dangerous viruses. What you're not used to is dealing with viruses out in the public. Were you ever afraid? Did you ever have those moments of fear like the rest of us did?
I mean, certainly, I wouldn't call it so much fear, but early on, I had gone to Southeast Asia on vacation with my husband in November of 2019. And I came back on Thanksgiving Day in the US, which is the fourth Thursday of November. And I was so sick. I hadn't been to China, but I had been to Angkor Wat and Singapore and Thailand and all these big tourist places where there were a lot of people, a lot of tourists from China and a lot of people who had probably traveled through China to get to those places. And I thought in probably sometime in early February, oh, I was really sick in late November of 2019 after going to a place where there's a lot of people from China. Mm-hmm. And fortunately, I am a scientist and I have colleagues who are actually working on that kind of stuff. So one of my colleagues at Mount Sinai School of Medicine in New York said that I could give him some of my sera and he would test it to see if I had antibodies to SARS-2. And it turned out that I was a very good negative control for helping him develop his antibody assay. So I did not have COVID. I just had some sort of terrible upper respiratory tract infection. But that was one of the times when I was like, did I bring it to the US? Could I have potentially been a person who was infected with SARS-2 and brought it to North America with me without realizing it. And, I always talk about that kind of stuff in papers and grants, and that's certainly a big driver of pandemics in our world is people's mobility. It was actually a really scary thought to think that I suddenly was one of those people that might have actually introduced this into my country. And even though I wasn't, it's something I think about quite a lot now when I'm traveling.
How did the work impact your personal life? Because I've gotten to know you a little bit, and I know you have no quit even now, and it's been a long 5 years. So how did it impact you personally?
I mean, it's impacted me profoundly from a personal point of view. On one hand, I feel like I'm a lot stronger. On the other hand, I feel like I just feel like I've been really beat up. And I feel really tired all the time. And I'm a lot more I'm a lot less trusting than I used to be, just because I've had so many experiences, I guess, with people acting in bad faith. One of the biggest problems, I think, and why I still continue to be involved in the communication space is that there is a lot of disinformation out there. And the people who are spreading this disinformation have financial and political incentives to continue doing so, which means they also have financial and political incentives to retaliate and silence their critics, including me. So it's something that I have to really try to manage for myself, because no matter how thick your skin is, if you get called a fraud and a loser and ugly and everything that has been said about me worthless as a human being, I mean, you can't be bathed in basically a deluge of unflattering, derogatory, dehumanizing comments and not have it have some effect on your mental health. So I really have to be careful that I make sure that I take time for me, that I try to manage work-life balance, which I'm actually pretty still terrible about. I definitely work too much, including at the communication parts, but it's important. And I have had several concerned friends recently pull me aside and say that, you can't do everything, and we're going to be in bad shape if you're not able to do anything. So you really do need to try to manage this. I think overall, I'm proud of what I've done in terms of helping people understand what's going on, in terms of advocating for my profession and its importance. And in terms of just helping people understand the risks that we face in terms of emerging infectious viruses and threats. But it's not easy. And I would encourage people when, you're fighting with somebody that you disagree with to just remember at the end of the day that they're a human being too.
You have almost 500,000 followers on Twitter. You're also on Blue Sky. I've seen the backlash. Yet you persist, and it's all in the name of science. What keeps you going?
Well, I see that some of the changes in the U.S. right now are actually an existential threat to my profession. So for all of the listeners who haven't been paying attention to anything besides the tariffs going on down south and the general craziness of this current presidential administration, thousands of my colleagues in the federal government who are scientists have been laid off for essentially no reason other than efficiency, supposed efficiency. This has depleted a lot of our core capacity in the U.S. for responding to outbreaks, including H5N1. There have been multiple attempts so far. None of them have succeeded yet, but I think they're going to continue to defund basically all NIH-funded research, which will definitely impact people here in Canada because the NIH is the largest funder of biomedical research in the world. And without this type of support, without the U.S. government funding a lot of this research, a lot of virology research is going to stop. And I'm not so much concerned that, I'm a virologist and I want to keep having a job. I mean, I work here in Canada and I do have funding for right now. But my bigger concern is there are a lot of emerging viruses out there, and people could run into one at any moment. Every day when people go out into the world, viruses that are circulating there might get into them. And that every time that happens, it's like buying a lottery ticket. Eventually, the viruses are going to come up with a winning ticket. And if we don't have the capacity to respond, which again, it's not just Canada's capacity to respond, it's also the US's, because they support so many response efforts all around the world. If we don't have that global coordinated network, if we don't have many major countries like the US working with the World Health Organization and working with other governments, we are all much less safe. And if you think about all the mistakes that were made during the COVID pandemic, which is something I think about all the time, imagine what would happen if we just didn't respond. And that's kind of the situation that we're looking at in the US for H5N1. If it does gain the ability to become a pandemic virus, we're looking at potentially a pandemic where there would be no meaningful efforts to develop vaccines, to control the outbreak, to surveil, to find new outbreaks, to find new cases. And that scares the hell out of me because the reason I became a virologist is to stop pandemics and epidemics from happening. We are in a situation right now that's extremely perilous, where basically the world is losing part of our ability to respond like that. And so I think it's more important to have virology research, to have epidemiology research, to have public health in place. It's more important than ever because we are at really high risk as a species and as a civilization and as a nation here in Canada of being profoundly affected by some of these emerging viruses. So that's kind of what keeps me going. I just need to keep speaking up and hopefully as increasing our capacity as much as we can.
And I'm going to continue with you in a couple of minutes when I want to bring in some of the other familiar faces, some of the other conversations we've had with people. One of those familiar faces is Dr. Alex Wong. He was a regular on CBC, on the National. Here he was on Blue Sky. He was on the Morning Edition. He was on the local news with me. And he used Twitter as well in the early days of the pandemic to get out information, which led him to become also very public facing. And one day it kind of ended abruptly. And I spoke to Dr. Wong about what was going on behind the scenes. So take me back to kind of 2 years ago when you really did pull back. You stopped doing interviews. We would ask. You would politely decline. You weren't ignoring us by any means. But what happened?
Truthfully, I was just tired. I was just really tired. And, there was a cost just purely from a time perspective in terms of wanting to make certain that when I was doing all of that stuff and being public facing and trying to provide information and trying to convey both certainty and uncertainty to the public, that I needed to do the best that I could to be as up to date and as current on all the information as possible. And that just in and of itself was an incredibly time-consuming thing to do. So it wasn't something that was done just kind of frivolously. There was a responsibility there of like, what, people are listening, and there's probably going to be some proportion of people who are really going to take what it is that I say probably seriously. And so taking that responsibility seriously was important, right? And trying to convey the scientific evidence as best as possible and the uncertainty as well. A lot of people talk about how, as we moved through the pandemic, that it became more challenging, right? As public health pieces and policy pieces and political pieces all started to kind of diverge a little bit. And that was definitely tough. I think, for all of us on the front lines providing healthcare, on the front lines, and for all of us who are trying to advocate with regards to the public health pieces and trying to help keep people safe. I mean, we were just all, I think, doing the best that we could. And we realized that there were, bigger pieces around policy and political dynamics, which we probably had limited to no control over at the end of the day. But I think at a base level for most of us on the front lines, we were just trying to support each other as best as we could. It was a really, really hard time, and there were times where it felt like we just couldn't do any more than we did. And people were still having bad outcomes, dying, and there was so much tragedy. And I realized again as I was moving into January, February, when everything was moving forward with, Omicron, and we knew that, all the measures were going to come to an end and so forth. I had some stuff happen physically where, I realized that was probably just, again, a significant physical manifestation of stress and just not taking care of myself, not taking care of my mental health and my body. And I realized that, I needed to let some of this stuff go, right? Just purely from a time perspective.
Okay, so let's talk about that. I think of this as when the wheels start to fall off, mentally or physically.
Yep.
When did your wheels start to fall off? And how? How did it manifest for you?
Yeah, I don't think anybody really ever actually saw my wheels fall off, either at work or, kind of in a public-facing setting. But like around mid-January or so, somewhere around that time, something happened to my body, and I just started like not being able to like really walk. It felt like my body had sort of seized up. And I didn't know what was going on, right? So I just kind of woke up and everything kind of seized up. I couldn't really walk very well. Everything was super tight. And so I went to physio and, I couldn't work. I had to take a couple weeks off. And I was really struggling. Like I was in a lot of pain and couldn't really do much of anything. And again, in hindsight, all of that was most likely sort of physical manifestation of just stress, of stress. And that was around mid to late January of 2022. A lot of things were moving at that time with regards to Omicron measures. We were still getting hit really, really hard in the healthcare system. In some ways there was more pressure than ever because that was, again, sort of, I felt a certain degree of pressure because there was this significant divergence at that point with regards to politics and policy and sort of what the public health leaders were saying. And it was like, oh, well, you're saying this, but they're saying that, right? And so that, again, I didn't realize it. You never really totally realize a lot of these things at the time, but looking back at it, yeah, that probably was kind of the beginning of the end for me at least, right?
How'd you fix it?
It was actually a massage therapist who actually saved me. And my wife had worked with her. She actually came to the house and, she, I guess, knew me from like all the stuff. And she respected some of the things that I had said and some of the things that I had done. And she basically got me unstuck, but it was painful. Like she worked on me in terms of just muscles and just kind of just starting to move properly again and getting everything kind of unstuck. And then, so yeah, I credit her, and I'm mindful now of some of the things that I need to do physically and from an exercise perspective and even from a mental health perspective that help to keep me away from that kind of place. But, like when your body's not cooperating, it can be a very frustrating thing, right?
Oh, yeah.
So I was clearly frustrated with all of that.
Dr. Wong now has 4 kids, one of them born during the pandemic. And like so many people, he was balancing a difficult job with the demands of home life. And I'm curious, and we'll talk with our other professionals about if they were able to create some boundaries during their, private time and time at home. But I want to play another excerpt of my conversation with Dr. Wong.
I just see that at a system level, I would say that the system does continue to struggle. I mean, we lost a lot of good people during COVID, and I think the system is
by
still... By
nature of quitting, they didn't die.
Yeah, no, just by nature of quitting.
Yes.
And just the fact that just so many of our good people just went so hard that they just had nothing left to give, when it was all said and done. And again, for a lot of us, a relative degree of moral trauma, moral injury probably played a role in some of those people moving on to either leaving healthcare or retiring and so forth. And I think the system is still trying to recover from all of that even today, like 2-3 years after the fact when everything kind of became pseudo-normal again, right?
You hear those words and the struggles that our healthcare system had. And I want to get reaction on thoughts from you, Angela. But first, I want to bring in Ayesha Kurji, Dr. Ayesha Kurji. She's a pediatrician in Saskatoon. We know that the pandemic was a rough time for kids. No school, no socialization, a lot of catching up to do. And we often went to Dr. Kurji for advice on kids' health and what do we do. Thanks for being here.
Thanks for having me.
You hear what Dr. Wong had to say, both about the personal toll, how he literally couldn't walk, but also on the system. What personal toll did it take on you?
That's a great question. I think It was a time where, we were working really hard on the front line as I work in the hospital in pediatrics on the ward, in clinic, also trying to do some of the education pieces as well. Sometimes having to actually recognize you need to set boundaries a little bit like what Dr. Wong said. Sometimes you have to say, nope, this is a time where I'm actually going to disconnect, make sure that I am taking care of myself and my family as well. So you're not going so hard all the time.
Do you feel that things are a little better for you in terms of the system, in terms of where you're working than they may have been 5 years ago or when things were at peak stress in like late 2020, early 2021?
Yeah, I think that, now, like, we still struggle with some of the things that we're seeing clinically. Still, the impact of the pandemic has had lots of different things that have happened for kids with mental health. But the stress of the pandemic itself and the, oh no, what's going to happen, that particular piece is maybe a little bit less, I'd say.
Angela, I'm wondering, as you heard Dr. Wong talk about the system and how we lost a lot of really good people in the science community, how have things shifted around? Are things better, worse, the same in terms of staffing, research, and your ability to still work on COVID or H5N1?
Yeah, so it's kind of a mixed bag, and it's different, obviously, here in Canada than it is in the U.S. right now, for the reasons that we spoke about a little earlier. In the U.S. right now, the situation is extremely dire, and that will have effects coming up to Canada, just because there is so much collaboration between the two countries, between scientists between the two countries, and there is still quite a lot of U.S. funding that comes to Canada as well. However, in Canada, we are still able to carry out and do our work. But there are some things that have been delayed or have been affected. For one thing, as part of Canada's response to the pandemic, and this is good, a lot of people were able to get containment labs certified and in working order so that more people could actually carry out work on SARS coronavirus 2. And some of that work continues, and those lab spaces are going to be useful for dealing with other emerging viruses, including H5N1. Canada has a very good regulation system for maintaining biosafety and biosecurity for handling these pathogens that need to be dealt with in containment. But there are big backlogs within the Canadian government. And I can say that probably extends throughout the Canadian government, because I certainly also had a very long process actually becoming a permanent resident of Canada when I moved here. And it actually took me 6 months to come up with a plan to actually be able to move here with my husband and my dogs and carry out quarantine and everything that we did in 2021. But the biggest issue, I would say, one of the bigger issues, is that within the government, there is a shortage of staff handling some of the biosecurity and biosafety issues. And so there's a large backlog of people who are waiting for security clearances to actually be able to work with these pathogens. It's not as critical as not having enough doctors in hospitals, that's for sure. But it has slowed down the pace at which Canada can carry out some of its objectives in terms of dealing with emerging pathogens, including H5N1. And this is an issue that I have raised both with local leadership here in the province, as well as with national leadership at the Public Health Agency of Canada.
Okay. Aisha, I want to rewind a little bit, because we had this part of the conversation with Angela in the beginning. And I always find it fascinating now that 5 years has passed and we've been through a lot. In some ways, it feels like another life. And in other ways, you could put yourself exactly back in certain moments of those early days of the pandemic. What do you remember about the early days of the pandemic in 2020?
I remember a lot of planning and a lot of what are we going to do when this hits and when we have our volume and capacity, and a lot of stress, a lot of late nights from that. And then in the pediatric world at the beginning, it didn't materialize the way we thought, right? Kids went into isolation and didn't go to school and didn't pass on their viruses. And so we actually had a bit of a lull initially in our hospitalizations. And then things changed quite a bit in terms of what we were seeing. While we weren't seeing the respiratory things, we were seeing the impact of of the pandemic on kids in other ways. And one of the things I really remember is seeing more kids admitted with eating disorders, which is not something that we expected, but was something that materialized in the pandemic, which is my special hat that I wear. One of the ones that I wear for pediatrics is at work. So that's what I remember early on is that. And then after that, more of the respiratory stuff that came up.
Did you ever have any moments of fear or concern, whether it was at work or at home?
I think we probably all did, a lot of the fear of unknown. What is this going to be? How is this going to play out? My parents live not here. They live in a different province in Canada. My family is spread out all over the place. So I remember lots of fear of, am I going to see them again? When are we going to see them again? I'm wondering what this is going to do for my kids, being away from school and their friends and their coping.
The reason I ask is just because talking with Dr. Wong, talking with Angela, talking with you, there were so many people we talked to who were just so matter of fact that we always felt comfortable and comforted in the information that was given to us, that I think a lot of times people never considered your personal fears as medical professionals and science professionals working to kind of get us through that. How did you, I want to talk about some of the hangovers in the pandemic in pediatrics in a minute, but how did you put up boundaries, manage your own mental health during that time?
That's such a great question. I definitely went through moments where I managed it better than others. Some of it was feeling a lot like I have to do everything in my power to make this better in whatever way I can, whether that's making sure I'm taking care of my patients in clinic, doing extra, being available for the ward if we needed extra, doing some of the education. So that was really hard. Trying to balance all of that. And then sometimes coming home and probably not being my best self, definitely not being my best self at home for my family, which is sometimes I think what we see. And so then trying to really work on how do we set boundaries? And it's okay to not be everything for everyone all the time. And you can't actually be everything for everyone all the time. And so maybe right now, one area needs to be a priority and some of the other pieces have to take a back step. And also knowing that we're not alone, right? And relying on our teams, whether it's at home or at work, to say, hey, let's split the work up so that we can figure out another way to do this.
What's changed in your practice since you've been practicing medicine then? A lot's changed in 5 years, but is there something you ask or something you do now that you maybe didn't do before?
I think for me in my outpatient clinic world, I see kids for lots of different things. Post-pandemic, I think we are all seeing more struggles for kids with mental health. And so that's something that even if kids are coming for asthma or other things, trying to remember to ask and check in on all of those pieces as well, and not just focus on the physical health.
Let's talk about what I've been calling, I don't know that this is a technical term, the pandemic hangovers. Things that have lingered from that intense period of time, and things particularly that the kids might be dealing with developmentally. Is there something that you're seeing more of?
So I mentioned it a little bit earlier, and the one big piece, along with all mental health struggles, I think we've seen increases in depression, we've seen increases in anxiety, difficulty with social interactions. The big one that was unexpected was eating disorders. And that's something we saw in Saskatoon, in Saskatchewan, nationally and internationally, that there was an increase in kids being hospitalized with eating disorders, an increase in kids suffering with eating disorders, much more than we expected.
When you say eating disorders, is there a specific of them that you're seeing more than others? And maybe some signs that maybe parents don't realize that their kid is struggling?
It's a great question. The big one that we saw in terms of hospitalizations was increases in anorexia nervosa. So kids who are struggling to get in what they need to, restricting what they eat, and not meeting their developmental needs. And remember, kids are supposed to be growing, right? So they're supposed to be gaining height. They're supposed to be gaining weight. And kids struggling with that has definitely been one that we've seen. I think at the beginning of during the pandemic, there was statistics that the number of hospitalizations for kids with anorexia nervosa tripled. And in terms of things to watch for, what we talk a lot about is watching your kids in terms of changes in their eating and changes in their exercise. So if you're all of a sudden seeing kids become more rigid around food, this is a good food, this is a bad food, this is an always okay food, this is a never okay food. Reading labels, wanting to eat by themselves, feeling like, oh, if I eat this piece of cake, I have to do exercise, or becoming really rigid about exercise. I can't miss working out. Those are all red flags that maybe we need to look a little bit closer at what's going on.
Are we still seeing them?
Yes. Yeah. So there is definitely an increase in sort of 21, 22. Maybe, and looking at our Saskatoon numbers, 2023 maybe went down a little bit. Then 2024 has kind of gone up. So it's not as much, there's not as big of an increase as there was right during the heat of the pandemic, but there's still a lot of kids struggling.
Angela, when it comes to hangovers from the pandemic, one of them I would say, and you may or may not agree, is vaccine hesitancy, particularly when we see the number of measles cases that are popping up. What can you tell me about that as someone who literally works with vaccines for a living?
Yeah, I mean, it's definitely pandemic related, but also not. I mean, the anti-vaccine movement, I think everybody really needs to understand this. The anti-vaccine movement's been around for quite a while. They are not motivated by the fact that they're worried about vaccine safety. Most of the most prominent, influential anti-vaxxers, including Robert F. Kennedy Jr., prior to his becoming the Secretary of Health and Human Services in the U.S., were actually making quite a lot of money from their anti-vaccine propaganda, essentially. Because many of the anti-vaxxers don't just say, don't take vaccines. They say, do this instead, and we'll conveniently sell it to you. So I really do want people to understand that the anti-vaccine movement is not just an ideological movement. It is one that is frequently motivated by profit and proximity to power, unfortunately. So the pandemic was the moment that many of these folks were waiting for. The pandemic really created huge divides in society. Public health got politicized, and it was really a perfect environment to begin really start spreading a lot of this disinformation about vaccines throughout the community. And this has been happening all over the world. There are many different reasons in different places for anti-vaccine beliefs and vaccine hesitancy. But here in Canada and North America, a big part of the reason for anti-vaccine views and vaccine hesitancy is really misinformation that has been spread about vaccines. People think that the vaccines are not safe. They think that they are less safe than actually getting COVID. They think that they don't work. And that's because largely of these large disinformation campaigns. How do we deal with that? I don't know, but I feel like you might be about to ask me about that.
Well, I was going to say, I wanted to know from Dr. Kurji if you're seeing vaccine hesitancy in parents of kids in your practice.
Yep, absolutely. And like Angie said, it was there before. It's certainly there now. And there's different ways it comes out. There's some families, even from before the pandemic, where we are talking about all vaccines as ones that they don't want to do. I would say there are lots of families also that will still do some of the routine childhood vaccines, still won't do the COVID vaccine or even flu vaccine. But it's a mix of everything and definitely something we see.
Are you, I was reading something about measles this morning. Is that something we're seeing? Have you seen in Saskatoon or heard about really becoming an issue in the province? Because that is entirely preventable with a vaccine.
It is entirely preventable with a vaccine. I haven't seen it myself yet. I think we have to be really cautious and recognize that it's coming and, if it's around us, whether it's in Saskatoon itself or in the province, it's something we need to be really cautious about. And this would be a great moment to remember that, yes, absolutely, we can prevent it with a vaccine.
Angela, as someone who, again, works with vaccines for a living, is it frustrating as you're working on emerging viruses and new vaccines to have to go back to things like the measles and say, oh, hey, this has existed for a long time?
Yeah, I mean, it's really frustrating. So I did my PhD at Columbia University with a guy named Vincent Racaniello, who is a polio expert. And I worked on polio and rhinovirus during my PhD. So I've actually seen what it looks like when you give polio to a mouse. It is horrifying, and I would never want to see that in a child. And I think one of the things that frustrates me the most is this disinformation that has been propagated, that it's actually healthier to get measles. It's healthier to get mumps. People used to do it all the time and nothing bad happened. One of my colleagues today pointed out that the last time cod liver oil was used to treat measles, 6,600 kids died of measles in the US that year. That was back in the 1930s.
Wow.
So these are not harmful diseases. These are not harmless diseases that people just get in childhood and develop immunity to, and no problem, everybody's had it. Polio will permanently disable people and potentially kill them. And that's why people used to be in iron lungs, because their diaphragms would be permanently paralyzed and they were not able to breathe on their own for the rest of their lives. Measles can cause deafness, blindness. It can cause horrible encephalitis. It can cause horrible respiratory disease. And it, as we've unfortunately seen, has killed at least one child in Texas. So these are not innocuous viruses that everybody just learned to live with until we got our luxurious vaccines. Vaccines have really made a profound difference in terms of the number of children that survive to adulthood. And I think it's really, really important for people to understand that, because it's incredibly frustrating hearing about children who are actually dying from diseases like measles that are preventable.
I'd like to go to the phones. We have Lee on the line in Saskatoon. And Lee, you have a question, and we can kind of decide who answers it after you ask the question. So go ahead.
Yeah, no, first I was just wondering how come you guys don't have Dr. Blondeau on there. Anyway, but it's about, I heard the radio station in Alberta many times over the last few years normalizing children having heart attacks. How it's perfectly normal for kids to be playing sports and they have heart attacks. And they normalize it. You hear it on the hour, every hour. And I was like, are you guys not hearing this? And then how come you guys aren't talking about the gain of function and everything that happened during that time and before that time? Like, I'm just curious. Like, I actually do my own research, and I've been in the hospital for like 3 surgeries. Every nurse and doctor that I've ever talked to, they have told me exactly. But then they say, don't say anything because we're not allowed to say anything.
Where are you getting your information? Lee, when you say you do your own research, but where are you doing the research?
From my ears. I go to the hospital. Like when I went to the hospital, I've talked to many nurses, many doctors, and I bring it all up. Like, where are all of these cases? I'd say with the funeral home, when I set up all of my funeral arrangements in 2022, he had told me that he has never been this busy since 2020 or 2021. And I'm right. You don't put 2 and 2 together. And he just went quiet. And it's just, I believe my eyes and my ears.
Okay.
And I also listen to Alex Jones. I know you guys think he's a conspiracy theorist, but even a clock is right twice. So, okay. I mean, at the end of the day, all people have to do is open up their eyes and their ears, do their own research, look up Peter Daszak. Like, I know they know what Peter Daszak's about, and that's why what is going on right now with the USAID, all of this, it's all pointing back to Peter Daszak. Everything is coming around.
Okay.
But unfortunately, there's so many people that are going to be killed in this.
Lee, thank you so much for your call. I think I'm going to direct this one to Angela, because I feel like this is more your area of expertise. We do have another caller on the line, so I don't want to take too much time on this response, but go ahead.
So I'll just be very brief about this. In terms of doing your own research, I've done my own research as well, and I've published 2 papers in Cell and 1 paper in Science that have gone through extensive peer review about the origins of the pandemic. On a personal note, I also personally know Peter Daszak, and there is no truth to what Lee has been told, or what his research has yielded. Mm-hmm. There is no scientific evidence whatsoever that supports the idea that the pandemic began as the result of so-called gain-of-function research occurring at the Wuhan Institute of Virology. Peter Daszak is essentially a figurehead for the EcoHealth Alliance. and was able to get funding for them. But a lot of their actual virology work was planned and executed both by researchers in the United States and in China. Some of this work was funded by USAID. That's a reference to the PREDICT program, which was a very large program to do virus discovery to try to identify pathogens that would emerge. It did not fund work to follow up on any of those pathogens or to juice them up in a lab. So Lee, I would encourage you to expand your sources for the research that you're doing, because much of that is incorrect, and I can actually show you papers explaining why.
There are a lot of listeners who have these conversations with loved ones. Angela, Lee is not the first person to bring this up. I see it all over social media as well. Where would you direct people for research that is peer-reviewed and falls into those papers you mentioned?
Yeah, so the papers themselves are called Cell. The first one in Cell from 2021 is a review. That might be some of the most accessible stuff to people. It's called The Origins of COVID-19, a critical review. The first author is Edward Holmes. The second paper in Science is from 2022. It was first authored by Michael Warby. That shows that the pandemic began at the Huanan Seafood Market, which was the result of the live animal trade and not in the laboratory, which is on the other side of the Yangtze River across town. And then more recently, another paper in Cell by Alex Christoph and colleagues, including me, was published last September. And it shows that there's genetic evidence of those animals at the seafood market that probably transmitted COVID onwards. However, Michael Warby and I have written an op-ed piece in 2022 in the Globe and Mail that explained what our findings were and explained to a general audience. So you can go ahead and look that up. That's by me, Angela Rassmussen, and Michael Warby, who is in the U.S., but he's actually Canadian. There have been a number of news stories about this, including one from I believe it aired last November on the National, interviewing me here at Vito about that last paper that I mentioned that shows genetic evidence of those animals, in which I explain it as well.
Okay, thank you.
So if you go to CDC, and we can put some links maybe, but there's a lot of sources.
There is, Aisha, this goes to show you, though, that the conversation around COVID's not over. Are you still seeing it come up in your patients? Are you still seeing people come in with COVID cases?
Yep, it does happen for sure. We have seen lots of different viruses in kids, and COVID is definitely one of them.
What about long COVID?
Oh, that's a great one. Definitely kids are not immune to the effects of long COVID. There are definitely kids who are struggling, who have long-term effects of this, whether it's, effects on school, effects on activity, lots of pieces of it too. Another reason to think about it is it's not gone, right?
I have my last question for you. I feel like we could do a whole afternoon on this. Aisha, what advice do you have for parents who might be struggling to find a family doctor right now and need a referral to someone like you? We know that this isn't a Saskatchewan problem. This is a problem right across North America, family doctors. What advice do you have for them?
Oh, that's such a tough one. I think everyone deserves a family doctor, and I wish we lived in a place where everyone had easy access to a family doctor. I think you have to keep checking in with places, because we know that it changes month to month, day to day, week to week. So keep looking. If you are struggling and you don't know where to go, our walk-in clinics are doing a phenomenal job of trying to help and sending referrals as we need to. If you need to go there, you have to. But keep your eye out, because it does change. We know, for example, family medicine residency, that most of the graduates will finish in June. So July is a good time to look and keep checking where they are and where they've settled. Some of the clinics are trying to put on their websites, look, we have space. They may not last for very long. So that's the other piece, is if you see something, don't wait to act on it. Get in right away.
Okay. Dr. Aisha Kurji, pediatrician in Saskatoon. Aisha, Angela Rassmussen, virologist at Vito. You can follow. I know Angela still does lots on social media. Dr. Kurji, not so much, but that's okay. We have boundaries, And maybe
That's
Angela
right.
will start enacting some. But thank you both so much for your time and your perspective today. I think that in these really weird times that we're living in, that it's really important to have these conversations and to have strong women in science and in medicine to represent. And you have both done that very well today. Thank you so much both for being here.
Thanks so much for having me, Sam. Nice to see you,
Thanks.
Aisha.
Thanks, Sam. Thanks, Auntie.